You're not going to believe the study I recently came across. As a urologist, I read medical papers every day, but this one caught my attention for its sheer curiosity factor and honestly for what it reveals about how our bodies develop. The study explored whether a completely unrelated body part might actually correlate with penile length. I know it sounds almost impossible, but science often leads us down fascinating roads that challenge what we assume to be true about anatomy and biology. For those of you who are new here, I'm Dr. Reena Malik, a urologist and pelvic surgeon. I spend my days treating patients and educating people about urologic and sexual health, topics that are too often misunderstood or surrounded by unnecessary stigma. My goal is to make this kind of information accessible, science-based, and judgment-free. So when I saw this study, I couldn't resist diving into what it might tell us about development, genetics, and the myths that surround male anatomy. This particular research was conducted in Japan and involved 136 men between the ages of 30 and 50 who had recently passed away. Within 3 days of their passing, researchers performed detailed autopsies, taking a series of precise anatomical measurements. They measured penile length in both the flaccid and stretched states, the weight of the prostate, the weight of the testicles, and here's the surprising part, the size of another body part that, at first glance, seems entirely unrelated to sexual organs. Now, before we get to that body part, it's important to understand why the researchers chose to study this in the first place. Previous studies had examined how penile length changes across a man's lifetime. They found that penile length increases steadily during childhood and adolescence, slows down in early adulthood, remains relatively stable through midlife, and may slightly decrease with age, often due to changes in connective tissue and reduced elasticity. However, those same studies left one question unanswered. What determines penile size in the first place? Is it purely genetic? Is it influenced by hormones, body composition, or developmental factors before birth? This new research set out to explore that question. The scientists hypothesized that if certain physical traits develop together in the womb, there might be correlations between them later in life. So they decided to compare penile measurements with other body measurements: height, weight, testicular size, prostate weight, and interestingly enough, the length of the nose. And here's where it gets fascinating. While height, weight, and other common body metrics showed no correlation with penile length, nose length did. Yes, you read that correctly. In this study, the men with longer noses tended to have longer penises when measured in the stretched state, a standard technique in urology for estimating erect length. The correlation wasn't massive, but it was statistically significant. Out of all the body measurements the researchers took, the nose was the only one that consistently matched with penile length. At first, it might sound like one of those urban myths. Big nose, big, the rest. But what makes this study interesting is that it brings scientific rigor to a topic that's often reduced to jokes or insecurity. The researchers carefully measured the nose from its midpoint down to the left and right sides, choosing the longer of the two distances for accuracy. And while this might seem trivial, their results suggested that both nose size and penile size may be influenced by similar hormonal or developmental factors that occur before birth. Here's why that might make sense. During fetal development, testosterone, the primary male sex hormone, plays a critical role in shaping both the reproductive organs and certain facial features, including the nose. Around weeks 8 to 12 of pregnancy, the fetus experiences a surge of testosterone that helps form the penis, scrotum, and other external genitalia. This same hormone also affects bone and cartilage growth, which could influence facial structure, including the nose. So, while it's certainly not accurate to say a larger nose causes a larger penis, both may be responding to the same hormonal signals during early development. That's what makes this study so fascinating. It doesn't suggest that nose size determines penis size, rather that both may reflect developmental processes that begin long before birth. It's a reminder of how interconnected the human body truly is. What seems unrelated at first glance may actually share deep biological roots. It's also important to note what the researchers did not find. There was no correlation between penile length and body height, weight, or even testicular or prostate size. This tells us that penile length isn't something that develops proportionally with overall body size. Instead, it appears to be largely predetermined, likely influenced by genetics and prenatal hormonal exposure rather than lifestyle or adult physical traits. In urology, we often use stretched penile length as a reliable measure because it closely approximates erect length. When the penis is stretched gently while flaccid, it gives a consistent, reproducible indicator of what the erect length would be. This method helps standardize measurements across research studies, since achieving a full erection isn't always possible or ethical in certain settings like post-mortem analysis. So the takeaway from this study isn't that you can predict someone's anatomy by looking at their face. It's that developmental biology is full of surprising relationships. The researchers concluded that penile length may be largely determined before birth and that external factors like age, height, or weight later in life have little influence. For most people, this study will probably be more of a fun conversation starter than a clinical revelation. But from a scientific standpoint, it offers a small but meaningful insight into how our bodies form and how the same hormonal environment that shapes one part of the body might influence another. And perhaps more importantly, it gives us an opportunity to talk openly about a topic that still carries a lot of unnecessary shame and anxiety. There's so much cultural obsession with penis size, yet, as this study shows, it's not something within anyone's control. It's a biological variation, like height or eye color. Understanding that can be liberating. It reminds us that sexual health function and confidence are not defined by measurements, but by overall well-being and self-awareness. In the end, the No study, as I like to call it, is a perfect example of how science can turn curiosity into understanding. Even the most lighthearted questions can reveal profound truths about human development. And as always, my biggest takeaway is this: the more we understand our bodies without shame, myths, or judgment, the better equipped we are to take care of them. As I always remind my viewers and patients alike, take care of yourself because you are absolutely worth it. Whenever I talk about studies like the nose and penile length correlation, people are often surprised that urologists actually study these things. But the truth is, our field isn't just about treating urinary issues or performing surgeries. It's about understanding how the human body develops, functions, and changes over time. And that means exploring questions that might sound odd or even humorous at first, but can reveal meaningful insights into male sexual health, anatomy, and psychology. When patients come to see me about concerns regarding their penis, whether it's about size, function, or appearance, the conversation almost always leads to a deeper discussion about confidence, identity, and self-perception. There's an enormous amount of misinformation online about what's considered normal. Movies, social media, and even pornography have distorted expectations to the point that many men genuinely believe they're abnormal when, statistically speaking, they are perfectly average. Let's start with what the science says. Multiple large-scale studies have found that the average erect penis length is about 5.60 inches, 13 cm, with most men falling within an inch above or below that range. The average flaccid length is around 3.6 inches, 9.6 cm. These numbers come from peer-reviewed research involving thousands of men across different age groups and ethnicities. The range of normal is quite broad, and most men are surprised to learn that they're far closer to the average than they think. But beyond these measurements, what really matters for sexual function isn't size, it's the overall health of the vascular and nervous systems that support erections. Erections are, at their core, a circulatory event. When a man becomes sexually aroused, the brain sends signals through the spinal cord to the nerves in the penis, triggering the release of nitric oxide, a molecule that relaxes blood vessel walls. This allows the penile arteries to dilate, increasing blood flow into the spongy erectile tissues known as the corpora cavernosa as these chambers fill with blood. They expand and compress the veins that normally drain blood out of the penis, creating firmness. When any part of this delicate system, the blood vessels, the nerves, or the hormones, isn't functioning properly, erectile dysfunction, ED, can occur. That's why I often tell my patients that the penis is like a barometer of overall health. It's one of the first organs to show signs of underlying issues like diabetes, hypertension, high cholesterol, or cardiovascular disease. The blood vessels in the penis are smaller than those in the heart, so they can show the effects of vascular damage much earlier. In fact, studies have shown that men who develop ED are at higher risk having a heart attack or stroke within the next 5 years. That's also why it's so important not to ignore changes in sexual function. Many men brush off occasional difficulties with erections as stress-related, and while stress can certainly play a role, persistent problems often point to something deeper. Addressing ED isn't just about restoring sexual performance, it's about uncovering potential health problems early when they're most treatable. From a hormonal standpoint, testosterone also plays a key role in sexual desire and function. Low testosterone levels can contribute to reduced libido, fatigue, and mood changes. While testosterone naturally declines with age, some men experience a more significant drop, known as hypogonadism. This condition can affect energy, focus, muscle mass, and even bone density. The good news is it's easily diagnosable with a simple blood test, and there are safe, evidence-based treatment options available when clinically appropriate. Of course, not all changes in sexual health are physical. Psychological factors like anxiety, depression, and relationship stress can have a profound effect on sexual function. The body and mind are intimately connected, and when one is out of balance, the other often follows. I frequently remind my patients that performance anxiety is incredibly common, especially in younger men. When you're worried about performing, you activate your body's stress response, which releases adrenaline, the very hormone that constricts blood vessels and makes it difficult to get or maintain an erection. It's a cruel irony that the more you worry, the harder it becomes. That's why open communication with your partner and with your doctor is so critical. Sexual difficulties should never be a source of shame. In medicine, we treat ED, premature ejaculation, and other sexual issues the same way we treat any other health concern, with compassion, evidence, and a focus on solutions. There are a variety of effective treatments available today, from oral medications like sildenafil's Viagra and tadalafil Cialis to injectable therapies, vacuum erection devices, and even surgical implants for more advanced cases. And for men seeking more holistic approaches, lifestyle changes such as regular exercise, a Mediterranean-style diet, quitting smoking, and managing stress can all significantly improve erectile function. What I find most rewarding in my work is helping patients understand that sexual health is not a luxury. It's an essential part of overall well-being. When men take care of their bodies, manage their stress, and maintain healthy communication in their relationships, their sexual function often improves naturally. It's not just about blood flow, it's about balance, physically, emotionally, and relationally. I often tell my patients that our sexual health reflects our general health in ways we don't always appreciate. For instance, studies have shown that men who engage in regular physical activity have a significantly lower risk of developing erectile dysfunction. Exercise improves blood flow, reduces inflammation, boosts mood, and helps regulate hormones. Even something as simple as walking briskly for 30 minutes a day can make a measurable difference. Diet is another powerful tool. Foods rich in antioxidants, healthy fats, and nitrates like leafy greens, berries, fish, and olive oil support vascular health and can improve nitric oxide production. On the other hand, processed foods, excessive sugar, and alcohol can impair blood flow and hormone balance. It's remarkable how often I see improvements in erectile function just from lifestyle changes alone. Finally, let's talk about one of the most persistent myths. I encounter the idea that penis size determines sexual satisfaction. Numerous studies have debunked this. What matters most to sexual partners is communication, emotional connection, and understanding each other's needs. In fact, the majority of women report that factors like foreplay, intimacy, and trust are far more important than size when it comes to sexual satisfaction. It's a reminder that confidence and compassion are far more powerful than any measurement. In short, sexual health is a window into your body's overall well-being, and caring for it means caring for yourself. The next time you come across a surprising study, like the one linking nose length and penile size, remember that it's less about the curiosity of the finding and more about what it reveals, that every part of our body, from our hormones to our anatomy, is connected in ways that tell a deeper story about who we are. If Chapter 1 was about understanding where these differences come from, Chapter 2 is about realizing what they mean for your health today, not in terms of comparison, but in terms of awareness. And as we move into Chapter 3, I want to shift from science to application, how to maintain sexual health, protect erectile function, and embrace a confident, balanced relationship with your body at every stage of life. When it comes to sexual health, one of the most common phrases people hear, often tossed around casually but rarely explained, is "who's it or lose it." And while that might sound like an oversimplified saying, there's actually a lot of truth behind it. As a urologist, I can tell you that regular sexual activity, whether it's with a partner or through masturbation, isn't just about pleasure, it's about maintaining the physical health of the penis and the complex systems that support sexual function. Erections serve a biological purpose far beyond reproduction. They help keep the penile tissue oxygenated, flexible, and healthy. During an erection, blood rushes into the penis, bringing oxygen to the smooth muscle and endothelial cells inside the erectile chambers. This oxygenation is vital because over time, a lack of it can lead to subtle structural changes, including decreased elasticity or even mild scarring, changes that can make it more difficult to achieve or maintain an erection later in life. That's one of the reasons men experience what are known as nocturnal or nighttime erections. These typically occur 3 to 5 times a night during sleep. particularly during REM's rapid eye movement cycles. They're the body's natural way of keeping the tissue healthy and well perfused. When these spontaneous erections stop happening due to chronic illness, hormonal changes, or lack of sexual activity, the penis doesn't get the same level of oxygenation, which can over time contribute to functional decline. So yes, in a very real sense, using it helps preserve the structures that allow you to use it in the future. But this isn't about frequency or performance pressure. It's about maintaining a healthy physiological pattern. Think of it like exercise. Regular movement keeps your muscles strong and your circulation robust. The same principle applies to sexual function. Of course, sexual health isn't just physical, it's deeply emotional and psychological as well. I often remind my patients that intimacy is not solely about sex, it's about connection. Emotional closeness, trust, and communication are the foundations of a fulfilling sexual relationship. When you're anxious, stressed, or preoccupied with performance, your body releases adrenaline, a hormone that constricts blood vessels and diverts blood flow away from the genitals. That's why performance anxiety can be so self-defeating. The more you worry, the harder it becomes to achieve an erection. In my practice, I encourage patients to reframe how they think about sex. Instead of focusing on performance, focus on connection and pleasure. When you prioritize intimacy and emotional safety, your body naturally relaxes, which allows arousal to occur more easily. This approach also helps break the vicious cycle of anxiety and dysfunction. And if you're experiencing persistent problems, know that it's not a reflection of your worth or masculinity. It's simply a health issue, one that can almost always be improved with the right combination of treatment, communication, and self-care. Hormones also play a crucial role in maintaining sexual function and desire. Testosterone, for example, doesn't just affect libido, it also supports muscle mass, bone density, mood stability, and energy levels. As men age, it's normal for testosterone to gradually decline. But for some, the drop can be more significant and lead to symptoms that interfere with daily life. If you've noticed persistent fatigue, reduced motivation, or loss of interest in sex, it's worth discussing with your doctor. Low testosterone can often be managed safely through lifestyle changes, treating underlying conditions, or when appropriate, hormone replacement therapy. Another important factor in maintaining sexual health is cardiovascular wellness. Because erections depend on healthy blood flow, anything that affects circulation, such as high blood pressure, diabetes, smoking, or obesity, can directly impact erectile function. In fact, erectile dysfunction is often one of the first warning signs of heart disease. I've seen many cases where a man comes to me for ED, and through further testing, we uncover early cardiovascular problems that might otherwise have gone unnoticed. Addressing those issues early can literally save lives. Lifestyle habits can make a tremendous difference. Regular physical activity improves blood flow, reduces stress, and boosts natural testosterone levels. A balanced diet rich in vegetables, fruits, lean proteins, and healthy fats, like those found in the Mediterranean diet, supports vascular health and hormonal balance. Sleep is equally essential. Inadequate rest can lower testosterone, increase stress hormones, and diminish libido. Even seemingly small changes, like cutting back on alcohol or quitting smoking, can have profound effects on erectile function. One of the most overlooked yet critical components of sexual wellness is self-compassion. Men often tie their sense of identity and self-worth to their sexual performance or anatomy, which can create unnecessary pressure. But sexual health, like any other aspect of health, ebbs and flows throughout life. Just as your energy levels, appetite, or mood change with time, so too can your sexual patterns. Understanding that these fluctuations are normal and that seeking help is a sign of self-care, not weakness, is key to maintaining confidence and fulfillment. Open dialogue with your partner also matters. Too often, when sexual issues arise, men withdraw emotionally, fearing judgment or rejection. But vulnerability and honesty are powerful. Discussing concerns openly can strengthen emotional bonds and reduce anxiety. Most partners value honesty and reassurance far more than perfection. In fact, when couples approach sexual challenges together as a shared experience rather than an individual failure, the results are almost always positive. In the broader sense, maintaining sexual health is really about maintaining overall health. I like to remind my patients that the penis is not an isolated organ. It's part of a larger, intricate system that reflects cardiovascular, endocrine, and neurological well-being. When you take care of your body as a whole, by eating well, staying active, managing stress, and nurturing your relationships, you're also taking care of your sexual health. Ultimately, the science of sexual health teaches us something profound about human connection. Our bodies are wired for intimacy, not just physical, but emotional and relational. Healthy sexuality is a reflection of balance between body and mind, self and partner, biology and behavior. Whether we're studying the curious link between nose size and penile length or helping someone manage erectile dysfunction, what we're really talking about is the same thing: understanding, acceptance, and the power of knowledge. So if there's one message I hope every reader takes away, it's this: your sexual health is a vital part of your overall well-being, and it deserves care, curiosity, and compassion. Don't ignore changes in your body. Don't be afraid to ask questions, and never let stigma stop you from seeking help. The more we normalize these conversations, the healthier and happier we all become. And as I always say at the end of every video and every patient visit, take care of yourself, because you are absolutely worth it.